African Health Products Regulatory Authority has drafted the requirements for the manufacture of ventilators. Healthcare in the country is running short of ventilators as we continue to battle the outbreak of Covid-19 here. The Regulatory Authority says it is fast-tracking ventilator licensing. Momeena Omarjee is the Acting Deputy of Medical Devices at the authority. Let's chat to her about what they're looking for. Momeena, good morning and thanks so much for your time. So obviously this is a very crucial, urgent need that we have at the moment, but you have to be very careful about what you give the go-ahead for.
Yes, so in this crisis period, we've got to have a compromise between increasing the availability of the ventilators due to this potential shortage in respiratory support. But at the same time, we've got to ensure that the products that come out and the products that are either locally manufactured or globally sourced still meet the standards of quality, safety and performance, and also meet the essential principles of safety and performance for use by clinicians and healthcare professionals around the globe and in South Africa as well.
So what are the minimum requirements then for the sale of these devices or equipment?
Okay, so what SAHPRA has done is we've amended the licensing pathway and we've drafted minimum specific specifications, clinically minimally specific specifications for use of these medical devices or these ventilators in South Africa. We've based that and we've adopted and aligned with the WHO technical specifications for invasive as well as non-invasive ventilators, and as well as the MHRA, which is the regulatory authority in the UK. We've aligned with their technical specifications as well to ensure that we make available to South Africans the products of the intended quality, safety and performance. So we've put that in place, which is the technical specifications, but we do have other licensing requirements, which are administrative license requirements, also in terms of the informations of use and the labelings and the packagings that need to then go with this ventilator to ensure that the users of these products have the necessary information on hand, and the clinicians have the necessary information on hand as well.
So, Momeena, just for clarity, and I mean, I don't know how the industry works, but would this be just for known manufacturers of equipment like this, or will you be looking at possibly new manufacturers as well, and will cost play a big part, who might come in cheaper as well?
There are projects underway, government projects underway to look for and to identify manufacturers, local manufacturers that rapidly establish, that can rapidly develop and design and then manufacture these products as well. So they are not necessarily medical device manufacturers, but they have local manufacturers that do have the requisite quality management systems in place to ensure that if they do manufacture these products, we would get a quality product out at the end. But they are requirements in place and requisites in place in terms of the quality management system that should be in place by that specific manufacturer to ensure that those products that come out are of the requisite quality.
And we know that there are many chancers who are trying to take advantage of the situation and the urgency of the situation at the moment when it comes to equipment like this, PPE, for example, as well. So what kind of testing process do you have? Do you test every single machine? Will you test one of a batch? How does it actually work?
In terms of ventilators and in terms of how SAHPRA works, we do not, as a regulator, we do not test the products. We ensure that the manufacturer puts in all these requirements in place to ensure that the product coming out is of the requisite quality. I mentioned the Annexure B of the MHRA technical specification document, which then speaks to the validation and the formative usability, so the testing of the product prior to it being put out onto the market. So they do extensive, rigorous testing on the product prior to its put out. They bring us the application, and as SAHPRA, we look at the application and we look at the documentation and the evidence and make a determination of whether the product and the tests that have been conducted comply with the specifications that we've put out. And that's how determination is made on the product.
Is there any independent entity then that actually is involved in that testing or does the approval, like the SNBS, as we know has done in the past? But do we just go on the word of these manufacturers? Do we just trust that they've done this, or is there an objective party that is actually involved in this?
In terms of the national ventilator projects, there are objective parties in terms of the validations and the testings that have been done. In terms of some of the other manufacturers, we are looking at the testing and the usability studies that have been found, and SAHPRA would be the objective eye in terms of the review of that data. So SAHPRA will be performing the conformity assessment function in terms of making the decision if that product is then up to the standards that we require and have met all technical specifications before we allow a Section 21 authorization of that product. In addition to that, we've placed additional conditions onto these rapidly developed either invasive or non-invasive ventilators for specific use during this emergency crisis, this COVID-19 emergency crisis. So we have put in additional conditions over and above the usual conditions we would put to any other licensed establishment to ensure, again, that the product that comes out is of a quality product, and any adverse events are immediately sent through to the regulator, and we will have a look at that as well.
Okay, thanks very much for that. And of course, yes, the need is urgent. We cannot stress enough, and as hopefully we will have those coming to the party and easing the pressure on our medical facilities. Still to come, the president called gender-based violence a